Hello friends, let's discuss the differences between norepinephrine and epinephrine. Both of these are present in the body and both are quite similar in their structure, but norepinephrine is essentially considered as a neurotransmitter, okay, and epinephrine is considered as a hormone. And this reason for considering them like that is because norepinephrine is released from the sympathetic neurons, the post ganglionic sympathetic neurons. They release norepinephrine. While in case of epinephrine, the source is adrenal medulla and it is released directly into the bloodstream. Okay, so when it is released directly into the bloodstream, it behaves just like a hormone. So that is one essential difference between norepinephrine and epinephrine, that you can call norepinephrine as a neurotransmitter while you can call epinephrine as a hormone. Okay, so that is one important difference. Another thing is the type of receptors which they act on. So norepinephrine, it acts on alpha, both alpha, alpha 1, alpha 2 and beta 1. Okay, while epinephrine, it acts on alpha, beta 1 and beta 2 as well. So how does that difference, why it becomes important? Because if you can understand that alpha, it is mostly present on the vessels, and on the vessels what you can see is it will cause vasoconstriction. All right, and beta 1 is present on two sides. One is the heart and second is the JG cells or the juxtaglomeralular apparatus. All right, and the beta 2, it is present on the vessels, and in the vessels it causes vasodilatation. Okay, so that changes the dynamics when we talk about the actions of these two on the cardiovascular system. So you can imagine, when you are giving norepinephrine, so there will be vasoconstriction and there will be a positive inotropic action. Positive inotropic action means increased force of contraction. Okay, and also there will be a positive chronotropic action. So chronotropic action means there will be increased heart rate. So these two actions, but uh, when we give norepinephrine, we do not see an increase in the heart rate, because the vasoconstriction which it causes, it increases the blood pressure, and this blood pressure is sensed by the vasomotor center, and it leads to what we call as a reflex bradycardia. So this reflex bradycardia is actually the effect which we finally see. So these two cancel out, and reflex bradycardia, it takes more than you can say, it reduces the heart rate rather than increasing. So with norepinephrine, what you will see a rise in the systolic blood pressure, a rise in the diastolic blood pressure, a rise in the mean blood pressure, and a rise in the pulse pressure. So pulse pressure is the difference between the systolic and diastolic. So you can understand the systolic rises more and diastolic rises, but not to as much extent. So the difference between the two increases. So there is a rise in all these parameters. So coming to adrenaline, in case of adrenaline, what happens is alpha gives you vasoconstriction, all right. Okay, beta 1 causes the same inotropic and chronotropic actions, just like beta 1 in norepinephrine. But this beta 2, this complicates the issue. What it does, it causes vasodilatation. Now, when vasodilatation happens, what will be the overall effect? You can see uh, the vasoconstriction caused by alpha will be negated. or reduced to some extent. So what you can see is there will be a rise in the systolic blood pressure, a fall in the diastolic blood pressure, okay, and the mean blood pressure, it remains the same or similar, okay, because the systolic is rising, the diastolic is falling, so the mean blood pressure is more or less the same. And what happens to the pulse pressure? Pulse pressure rises, and it rises much more than what we have seen in case of norepinephrine, okay. So that is one very important difference in between these two as we talk about the cardiovascular effects. Now another thing, since the mean blood pressure is more or less similar, there is no reflex bradycardia, okay. So there is no reflex bradycardia. So heart rate may be normal, may be a little bit increased, but it cannot be the same, or it cannot be a bradycardia in case of epinephrine, okay. I hope that clears up the differences between norepinephrine and epinephrine. Thank you so much.